We're about to get started. If people want to take their seat again for this amazing panel you do not want to miss. We are here for the Sustaining a Community Direct Stories on Creating Equitable Food Access Everyday panel with three amazing women in organizations that are doing incredible work. And I want them to start by introducing themselves and their organizations. And Dr. Rosamaria Murillo, we're going to have you begin. Oh, sorry, I just realized 1 second. I should introduce myself, Karen Magid. I'll be your moderator today. I'm so excited for this conversation that I just skipped right over that. I work for Huston-Tillotson University, and I'm really pleased to be here with you. So, Dr. Murillo.
Thank you. Hi. I'm the Chief Executive Officer for El Buen Samaritano. I came to El Buen right before the pandemic. My task was to reinvent El Buen that had just undergone tremendous change by saying goodbye to their direct healthcare component. And so my task was to rebuild it, focusing on the social determinants of health, like our other panelists were talking about, because of the key connection to health. And then like a few months later, COVID hit, right? So that sped the transformation of El Buen. March 17, we transformed El Buen from an organization that was serving about 100 families per month through our pantry to serving 700 families per week. And so let me just back up a little bit. El Buen focuses on three key things: access to health, education, and those essential needs that we all need. So those three areas are the focus for El Buen. Throughout the pandemic, we have shifted our framework. We used to say we had a pantry. It is not a pantry. It is not a charitable pantry. It is a social justice, food equity and access revolution, right? We are not interested in just handing out food for a day. We are interested in collaborating and connecting with partners to build the infrastructure, to reinforce the infrastructure. There is so much wealth and resources in this community. And I was hearing the chefs talk about being unapologetic. I am unapologetic about those resources. We also do adult education. We do youth services. We have a very strong collaboration with Lone Star Circle of Care, which is an FQHD. And together with them, we pair clinical services with social determinants of health services. And so just a few numbers. Fiscal year 21, we will have served close to 40,000 individuals with access to food, hitting all the zip codes that our colleagues were talking about. And we did not do that by ourselves. We did that in collaboration with partners. By the end of February, we had distributed close to $7 million in financial assistance. And again, didn't do that by ourselves, in collaboration. And, you know, I can go on and on, but just an honor to be here.
Yes, and I'm really excited. We're going to dig into more of these connections and the social determinants of health, which is an excellent place, I think, for Kate Taylor to begin.
Absolutely. Thank you so much. My name is Kate Taylor, and I work for Center for Survivors of Torture. We provide free mental health services to refugees, asylum seekers, and immigrants with any kind of immigration status. With that being said, we're keenly aware of the ways in which food equity impacts someone's ability to engage in mental health counseling. And so excited to be here to talk a little bit about how we've partnered with different members of our community to address that drastic need pre and post or during pandemic. It is something that we have always been very aware of in our office. We always have food available for our clients because it's really hard to go in and talk about some of the hardest moments of your life if you're starving. And so that has been crucial to our ability to continue, especially right now.
Thanks. And Phyllis.
Good afternoon, everyone. My name is Phyllis Everette. I am the CEO and founder of Saffron Trust Women's Foundation. We're an organization located in Central Texas, and what we do is we cycle women out of poverty by acting as a diversion program. I moved to Texas 5 years ago, and I moved to Texas because it was the best place to live. I'm from New York City, and I've been searching for a place to live. My grandchildren are going to UT, and I packed up and I moved to Texas happy. I was very happy. And so it was very shocking to me to find out that 1 in 4 families were food insecure here in Austin, Texas. And the disparities were massive here. I've always been in the space where I've helped people and done missions work, and at the time I was working for a director of a healthcare facility, and I found out, again, that 1 in 4 families were food insecure, and some of the disparities here, and that Austin was the most economically segregated city in the country. And so when the people who are in marginalized communities, when there's any kind of insecurities, they're really severe. I started out my organization just by going into restaurants because I didn't understand how 1 in 4 families could be food insecure. I had lived here in like 6 months and gained 40 pounds. The food was just so good. I was up and down the highways just eating everything. I hadn't eaten red meats probably since I was 20 years old, and I went into a place called Rudy's to get some gas one day. And I've been eating there ever since. That's how good the food is. And I just feel like good food shouldn't be for a privileged few. It should be a right for all. And knowing that and having a passion to help people is what started Saffron Trust. And we started in the beginning just going into restaurants. And once you give most restaurants the statistics of what's happening and you ask them their corporate social responsibility, people really want to make a difference. They just don't know. And because of the divide, we're doing really well. You don't know that so many people in Austin are suffering from food insecurity. And so we started this thing called Trend Setting the Table, where we'd go into restaurants on a quarterly basis, and restaurants would open up their door, and we had a round table for families to just sit and eat. And so it wasn't important to just fill people's bellies, but to educate them, because the allostatic load and the health outcomes were really important to us. And so we've been doing it a little over 2.5 years now. COVID came along, and the families could no longer go to restaurants. And my lovely friend Karen said there are no restaurants, but we can partner with other organizations and see how we can get healthy prepared food to Saffron Trust. So a little over a year and a half, we have 3 locations where we distribute food. We do about 3,000 meals on a monthly basis, thanks to Cook Nooks and several other restaurants that have joined in during the holidays to prepare fresh meals. And through that, I've come into the food space now, so it's relatively new for me. For the others here, it may not be, but for me, it's very new, and we'll talk more about that later.
Yes, thank you. Part of this conversation, I think, is really centering the core populations that you're working with. And I want you to just spend a little bit of time talking about what the core populations you're working with are facing every day. Dr. Murillo, we'll start with you.
I'm going to ask you to close your eyes because I want you to visualize 3 women walking for about 5 miles to reach El Buen Samaritano, which is South Austin. They had 4 children with them, 2 that could not walk. Walking, these women finding food. By the time they got to El Buen Samaritano, we had finished our services, and I could not let them go without anything. So we went into our space where we have food and gather whatever we could. and provided bags of food, and then thought, how will these women get home? With children on hand, one wrapping their bag. And so they didn't want to take a lift over, they didn't want to take a ride. These were proud women that were looking to thrive and make sure that their children did not go without food. And all they wanted was, can we tell them where the nearest bus stop was? And so we got a little cartwheel and walked with them to the bus stop. And my staff said, well, why did you let them go in the bus? Why couldn't you just get them in your car? And I said, these are powerful women, strong women. They don't need my car. They need to figure out how they're going to thrive and how their children will survive. Women and men, mothers and dads, caretakers, coming to when in that kind of situation, and not just through the pandemic, but think about it during Uri. Let us not forget, on top of the pandemic, what we had to experience. I also want you to feel in your gut the sense of running out of food when you're in the business of creating access to food. And we had that experience every day. So I bring this to you because I am reminded not just of the power of the people that we are serving, but also the power of the people that are serving in these very difficult times, and the re-traumatization that many of us experience, because the people at Edwin are the people that at one time walked miles to access food or access any kind of support from community. And so it's important to me to not forget that the human element of this work as we talk about food. And I probably didn't answer your question.
You absolutely did in a really powerful way. And Kate, I'd love to hear from you.
Absolutely. I would love to echo the sentiment that you've expressed in terms of, before I dive into the conditions that our clients face, just really emphasizing that at Center for Survivors of Torture, our clients are incredible. They are the most resilient clients I've ever worked with in more than 10 years as a social worker. I've never seen people that can persevere as boldly and courageously as our clients do, not to minimize any other populations I've ever worked with, but it's been miraculous. And that aside, looking at the strengths and keeping that in mind, our clients are facing extreme food insecurity. They're facing extreme trauma. They're facing homelessness on almost a daily basis. As immigrants, depending on where they are in their immigration status, they may or may not be able to work because work authorization, especially in the last 2 years, has been extremely delayed because of the pandemic and the way that the systems have adjusted. So the ability to provide for your family, especially as someone that has flown a situation where your life is threatened, and to come here and want nothing more than to have dreams and to have children that can look forward and achieve the things that those of us who are born in the United States kind of inherently have access to, it's really hard. And so food access, when we look at Maslow's hierarchy, which I have mixed feelings about, if I'm being honest, because I think that there are lots of people that can self-actualize at any kind of stage there. But it's really hard to be hungry and then to try and also make your dreams come true. So that's a pretty key component in what our clients are facing. So yeah, I'll pass off.
Wow. When I think about some of the families and what they're facing, I got a phone call last night from a friend of mine, and she said she had stopped at the gas station to fill up her truck, her vehicle, yesterday. And she said, Phyllis, it cost me $150 to fill up my vehicle. And immediately I thought about the families that I serve. how much of an impact that's going to make on them, because there isn't anything in the reserves to pull out an extra $50 a week for gas. I think about the mom who has to drop her kid off and get to school on time, but she get to work on time, but she's late because she can't afford to get in the express lane on MOPAC, right? But if she doesn't get in the express lane when she gets to work, her boss is like, you're 15 minutes late, but she's trying to explain that the daycare doesn't open until 7. And so I think about all the different ebbs and flows that go on in our country or in Austin, and things that change, and those who are already suffering from food insecurity that may not be related to homelessness, but a mom who is working, and everything is by the penny, and it could make a difference. And food insecurity is really a big issue, because most of the people who face food insecurity is the intersection to everything else. It's the intersection to not having gas or getting your car registered and all those other different things. And it becomes a spiraling effect of things that just continue to, go down and down and down for a family that may be in need. And so food is so important, because having the right nutrition keeps them healthy, keeps them functioning. I think about the price of water. It could be $2 but some of the families that I serve, high C, 72 ounces is 78 cents. And you have 3 children. Are you going to buy the water, or are you going to buy, the drinks? And those that lands into some of the, when we talk about the health outcomes, food is definitely a big issue, and food insecurity is even a bigger one. So when I think about what my families face, food insecurity, and then all the other things, all the other stresses, all the other disparities that other people may not even be thinking about. My girlfriend who filled up her tank for $150, she was just surprised that it cost that much. It wasn't going to affect her mortgage. It wasn't going to affect her light bill. But for my families, it's a big difference. It's a big impact.
Yes, and with that, given that, the population, the target population is at the core, and Phyllis, I want to start with you, talking about how then you've built your programs and strategies around these intersections, and considering, how, those people that you're working with. And I know, especially because this food, centered around food access, this work is relatively new to you. So I'd love to hear you talk about then how you built these programs.
Yeah, as you know, as I mentioned before, I was quite surprised that 1 in 4 families in Austin, Texas were food insecure, because I ate everything I wanted. And I grew up in New York City, and I am third generation of generational poverty. But my children and I, we still ate well. So I didn't understand that when I came to Austin, how that could be. And so I began to voice how I felt to a lot of the leaders in the community. I was part of Leadership Austin, and also a lot of other different forums where I had a seat at the table. And they were like, Phyllis, what do you want? And I was just like, I need you to open your restaurant and feed families. And so we started this roundtable session where families can come in and talk, and we had experts from the field in different areas come in to be a support for families and women. And then when COVID-19 came along, and we couldn't bring the families to the restaurants, we were like, how do we bring food to a place where people can have access to? And when Karen said, we have a lot of food for you, the first thing I said was, we don't even have a staff. We don't even have general funding. I've only been operating, 1 year. How am I going to do this? And Workforce had just got a disaster recovery relief program where they employed workers. And so one of my board members had a location at the church. And then we had a delivery service that delivered the food. So we literally created an end-to-end strategy with 5 partners. Cook Nooks created the food. Try Hungry delivered the food. We housed the food at Mount Zion Baptist Church. And Workforce paid the employees livable wages. And then Saffron Trust handed the meal to a family. So it took 5 partnerships to feed 1 mouth. And to date, we've distributed over 120,000 meals in just a little over a year.
Thank you. Kate?
partnerships is also how CST has been able to bridge that gap with food equity for our clients. For us, when the pandemic began March 17th, we'd made the decision to close our office. We realized that our clients were going to be highly susceptible to catching COVID-19 and that was going to be devastating for their health if it happened. And so we strategically rallied and got together, transitioned everything to remote services, luckily had a very resilient staff and also clients that were able to adjust to the way we transitioned our program. But our executive director, Celia Van de Graaf, had the brilliant idea to start reaching out to city council, and she said, we need to figure out how to feed our clients. I don't care about mental health counseling right now. What they need is food, because they're going to lose their jobs with the pandemic and restaurants shutting down, because oftentimes our clients are working in restaurants. And so we started to connect with policy aides at District 7 and District 10 and got really, really lucky. We were connected with one of the former panelists, Robert Nathan Allen, who was part of the Keep Austin Together program, which led us to the Cook's Nook, working with Joy and the team at the Cook's Nook. Since May of 2020, we've delivered 43,000 meals, all because we have an incredible staff member, a Nepali interpreter, and a Nepali community leader, Nagendra Basnet, who, if he's watching, shout out. We couldn't make this happen without him. He delivers to 50 client families, which means far over 100 different clients, but 660 meals each week right now. At CST, we've delivered a little less impressive number, but I still feel it's impressive. Over 43,000 meals since May of 2020. And, you know, again, it was just knowing that we had to meet that need for our clients. And so just being aware of the community, working with people that were passionate and willing to put in the legwork and also to step up in big ways. It's been, I mean, I would like to say pretty seamless, just because people care so much. And, you know, the county has stepped up to fund the program, the Supplemental Emergency Food Access Network program that we're able to provide these meals through. And without it, I mean, our clients very well could have gone hungry and been in a very bad way in the last 2 years. So, yeah.
I just want to highlight so far, so the running tally is 163,000 meals from 2 organizations alone. I just want to point that out. And then 40,000, yes, please. And then 40,000 individuals. So that's not even a meal count. That's 40,000 individuals helped with food access. But I want to hear more, especially as you mentioned, El Buen transitioned and pivoted. So how have you built these new strategies and new programs?
And I'm smiling because I'm going back to March 17. Everybody remembers that day, right? Like, who are we? Where are we? What are we? And yes, yes. And so I'm a public health practitioner at heart. I work in public health for 100 years. And in that space, I was used to doing emergency response operations, I would get excited, like, okay, we're gonna, not happy, but like, we're gonna serve the masses. So I come to El Buen with that background, and I asked my team, which at the time was a team of, we had lost all of our volunteers, and we had close to 200 volunteers, right? Remember I said El Buen had just undergone major transition and lost over 70% of its workforce. So I had a team of about 15 people that could come and work on site. And I asked them, have any of you ever done emergency response operations? And they said, what is that? Right? Because I knew that El Buen had to prepare itself, build its infrastructure to respond at a level never seen before by that organization or any nonprofit organization in Austin, any of us, right? Yes, many have worked in responding and helping out, but at that level. And so it was important to me that El Buen structure itself as an emergency response operations with all the details that go into that. Because we were going to get ready to serve not 100 families per month, but 700 families per month, and we couldn't do that. So we had to build the infrastructure. had to do the loving and nurturing of staff, right? Like they're scared too. And like they don't know what's going to happen. And so lots of infrastructure work within the organization to set us up to be able to respond to the massive need to provide food, but also access to cash, financial assistance. El Buen had done some assistance, financial assistance, like $50 for medications or here or there, right? The city approached us and said, do you think you could distribute $500,000 in cash assistance? My CFO was like, you're nuts. Yeah, we'll do it. We'll do it. Like, we'll do it. Because we had, on that week when all of us lost who we were, we have lost who we were, right? We're different people now. People were walking to El Buen, coming to El Buen, asking for whatever help they could get, scared, lost. I said, we'll do it. Don't tell the city this. We still didn't have the infrastructure to distribute $500,000. We were building the plane as we were flying it, right? I'm sure you all have that experience, right? Yes, yeah, we're great pilots. We're great pilots, and staff is holding on to that half-built plane with us, right? So we did that, but that helped us to build our controls to be able to distribute more. So then the next month, the city comes, can you do 1 million? I go, sure. And they go, in a month? Of course. Right, we had, the option that I had was to say yes, because I knew that there were many of the people, like the people the communities that you serve, that did not qualify for, like my niece said, cheque de Trump. Get it? Could not qualify for the federal stimulus checks, right? And so I was going to do, as an organization, not just I, as an organization, was going to do what it took to get that cash to people that would not otherwise qualified for financial assistance. And so to your question, what strategy did we use? Like build little by little the organization as an emergency response operations organization. The other piece was data. And I know data is oftentimes the oppressive friend, right? It is used to oppress our communities. For me, I needed that data to be able to understand where we were serving and who we were serving, right? I needed that data to ensure equity and access to food, cash, education, and COVID vaccines. That's the other piece, right? When our older Black and Latino members of our community were being left behind because of access, right? We were doing one-on-one direct connection to those vaccines. And I am so proud to say that as of today, we have vaccinated over 2,000 individuals. And yesterday, last night, we had a vaccine clinic, and we vaccinated 200 individuals. Still, like just when I think, oh, no. Like we started out with 50, like 50 came. This was after we were doing the one-on-one, like literally one-on-one connection to a PH for a vaccine. We started out with 50 and we thought we were doing great. And then it got to 100, and then 150, and last night was 200. So, and there's still more, right? There's still more. Back to the piece of access. Data was very critical for us, but nobody wants to pay for data. But they require data so that they can pay for services, right? So I had to set the the organization in a way that little by little we were building our technology and data infrastructure to the point that where now we have real-time data maps. I love it. I don't know how they create them, but I love it. Like, I just told the data guy, please, that you can go into those maps and see real-time where we're serving and how many people we're serving, and are we really going to the communities that need it? So critical. So I get passionate about data.
No, this is so perfect. So I want to highlight, I mean, here we are at the future of food, which is going to ping to my next question, but the innovation at South, here we are at South by Southwest Innovation, and for me, this is the real innovation that you're talking about. I'm so honored to be able to help champion all the work that you're doing. And a couple of things, one thing that you mentioned that I want to talk about, that you're still doing, 200 vaccines. Like, this work is ongoing. I know we were chatting in advance, and I want you to share what you still need to be doing this work. What do you need more of? We've talked about partnerships. We've talked about data. I want you to tell people what you need to keep doing this work. Phyllis, you look ready.
Oh, yeah, I am ready. The one thing I need is for everybody to take out their phones right now and follow us on Instagram. Relationships are very important, especially people in the food and the kind of space that we're in. I find out about more of the people who do that kind of, or in this kind of space through digital social media. So that's really important. Our Instagram is saffrontrust.org. So please, if you can follow us today and see the work that we're doing, and others see the work through your platforms, and they reach out to us. So that's always an important need. And the other thing is general funding. We definitely need general funding. We need volunteers. I think that comes with awareness. That's why I said follow us on social media first, because when people are aware, they want to help. When I walked into the restaurants and I said, did you know 1 in 4 families were food insecure here in Austin? They were like, no, I didn't know. I said, and they were like, Phyllis, well, what do you want us to do? People want to do something genuinely. They don't want to see others that are suffering. And we have a lot of transplants here in Austin, and they're not aware. Like, I thought Austin was the best place to live until I found out it was the tale of two cities and how the divide is. And so people just don't know, but their heart is willing to do something different, is willing to extend a hand to those who are less fortunate. So general funding and follow us on social media is just really important. And all the people who do the work. So it's not just me, because on my platform, we also give visibility to El Buen and all the other organizations that are doing great work, where there's going to be a clinic set up so people can get vaccines, where they can go outside from, we serve food from 11 a.m. to 3 p.m., but there are many, many, many other people that are doing this great work. And when people see the work that we do, they just really want to make a difference. I think it was social media, which is really what pulled a lot of the restaurants. We have a lot of 5-star restaurants in Austin, Texas, that become a big part of the work we do. We have what's called a Breaking Bread Quarterly, which is what started Saffron Trust. But in December, we partnered with Hanks on Cameron Road, and they fed 50 families. Jack Allen's, and they didn't feed them leftovers. They fed them quality food. And and then we had Jack Allen's that also did it. We had Papa Do's. We're going to be having a big dinner at Plank's Restaurant in the Domain. So restaurants really want to play a part of this whole food conversation and help to eliminate in any kind of way that they could. They may not have the footprint in the community, but El Buen, I do. And so they'll reach out to folks like us, and we're willing to do the work. We're going to roll up our sleeves. We're going to make a difference. We're with the families every day. We're sitting on their sofas. We know their children's name. We know the struggles that they're having. We know the job situations that they're facing. We know the job loss that they're facing. We know that the tech industry is taking over Austin, Texas. We know the people that we need to get into programs so they can become more educated, so they can get the jobs. I mean, we think about if people are not going into the tech industry, what kind of jobs are they going to have? And how the heck are they going to live on $15 an hour? How? And so when we talk about this food insecurity, the first thing that's going to, the thing that helps is us to continue to give the food to offload that stress, right? Because if we're serving, El Buen and I, fresh foods, you figure even if we're serving just, 20 families a week, and we talk about $10 a meal, I mean, that's an extra $500, $600 a month just for a family that we're feeding, that they can take that $500 or $600. They can pay their car note to get to work. They can pay their insurance. They can pay their rent. They can pay their mortgage. Little Johnny can participate in a basketball, activity, or children, can do other things. One of the other things that we do with Saffron Trust, we find out that we found out, because this is new to me, but food is the intersection for all the disparities. And so when we find out what some of the stresses are, we talk about play equity. Children not being able to play and do simple things like you and I do. Go to the opera, go to the ballet, go sit and participate in the arts. So we've developed a Heart for the Arts program. We partner with Austin Opera House, the ballet, Zach Theater, and Texas Performing Arts, where we take families, why they're going through this kind of stress, why they're faced with how do they pay their rent. Well, come on, let's take you out, to go see an opera. We took like 20 children to the opera, the Longfellow Theater? Long Center. I'm thinking of New York, I forget. Long Center, to see Steve Jobs' performance, and the children loved it. We took about 50 children and their parents to see during the holiday, to see the Nutcracker. There are so many things that they don't participate in when you're cash starved. You cannot afford $10 for your children to participate in the arts or see a program. So it's food, it's not being able to have recreational abilities. It's so many different things. And like Albuen, Saffron Trust was blessed to give out a certain amount of money. We didn't get as much as you did, but we got $200,000, and we were like, how are we going to give out this money? But people were getting evicted from their apartments because their $40 electric bill got cut off, and the apartment complex knew that they didn't pay the electric bill, so they charged the fee onto them, and so the rent that was $600 was now $1,200. And so, these are some of the things. So general funding, and follow us on social media. Thank you.
Absolutely. I mean, I think that very similar things are needed for us as well at CST, but I would say keep your eyes up and your hearts open. There are people all around you that are facing experiences that we may or may not be able to imagine. So practicing that humility, you're already here educating yourself, but I hope that you continue to reflect on what you learn and think about the people around you as you walk through the city, and what might their experience be when they go home, and how can I be a part of impacting their ability to connect to really crucial services. That being said, just focusing on why I'm here in terms of as a representative with Center for Survivors of Torture and really the Cook's Nook bringing us in, I hope that we continue to think about programs and partnerships like what we're experiencing right now with the Cook's Nook, not as a pandemic problem, but as an everyday problem, something that we need to continue to partner together to do. We don't need to just be responsive when there's a crisis, but how do we work together as a community to do this all the time? Because that's really what matters. Regardless of whether or not there's a disease that's wiping us out in masses, or, the winter freeze, like on a daily basis when the weather is like this and it's gorgeous and maybe, you can take a nap on the sidewalk, you still might be starving. And so how do we continue to amplify these programs and convince the city that this programming, this funding is vital to the survival of our community members that have a lot of value, and really make this place a great place to live. So that would be what I'd say. Feel free to follow us. I mean, we're always, I think that survivors of torture, it's a unique population, and people may or may not know about the work we do. So we hope that you don't hear torture and shy away, but actually say like, wow, I wonder what that experience has brought that person in terms of their perspective. So, yeah.
Thank you.
Yeah.
Dr. Murillo?
Don't ever ask me what I need.
Let's bring it.
Right? I'm going to sound like somebody many of you know, a revolution. Right? That's what it's going to take. All right? I want all of your expertise in this space to come and join us, because there are kids right now that need a tutor, that need a role model, that need access to education. So I want everyone in here to roll up your sleeves. Somebody earlier said we're really putting Band-Aids. Let us not be ashamed of that, because in the continuum of powerful individuals. It's all that. And any one of us can be at that point where we're going to need a Band-Aid. So I need some really good Band-Aid folks, right? Just like I need those that are out there doing policies that are requiring and contributing to the need for Band-Aids, right? So it is so big and overwhelming what I want that I will not live long enough to see it happen, but I hope it will. I know it will. Right here, right now, what I need is probably around 12 tutors that are focusing on science, technology, math, and the arts. I need that for the youth that we're serving. So if you have connections to people that have those skills, that's one thing I need. Partnerships, always. We can do this alone. And the other want is for this such a wealthy community to understand that their well-being is dependent on our well-being, to make that connection. The well-being of people in Ukraine depends on our well-being too. And I will live and will remind and will want constantly to my last breath that we can see that interconnection that we have from the wealthiest to the not so wealthy in our community. I know that's very abstract, but I, like told you.
No, we need all of those action, all of that action. And I could keep asking questions. I do want to see if there's any audience questions for this amazing group. One quick question. Do we have one?
So I live out in Hayes County, and so I'm wondering, do you guys have any partnerships out there that feeds to that community as well?
We do. Our partners, we have right now about a total of 40 partners, and between them, we cover Travis, Hayes, Bastrop, Caldwell, and part of Williamson. And that's
The access, can we find out about that through Elwyn?
elwen.org.
Perfect.
Yes.
Thank you.
Yes.
Yes, I think so much more good information to be found at each of these organizations' websites, and follow their social media and keep learning and keep connecting. So let's thank these amazing people, and thank you for your time today.